Along the natural flow of time, increasing age brings many changes to the body, among which the decline in bone density is an inevitable process. The gradual loss of minerals in the bones not only weakens them, but also increases the risk of osteoporosis, fractures, and other serious complications, especially in the elderly. However, this process can be slowed down through a reasonable, regular exercise routine that is personalized to suit each individual's physical condition. Physical exercise not only helps maintain overall health, but also plays a key role in protecting and strengthening the bones, the foundation for each person's flexible and free movement ability. Every time we move, especially activities that bear the impact of gravity, such as walking, climbing stairs, or dancing, bone-forming cells are stimulated to regenerate, repair, and reinforce the bone structure. Bones are living tissue, constantly changing and adapting to external forces. When muscles contract, the mechanical force transmitted to the bones promotes the activity of bone-forming cells, thereby helping bones develop firmly, maintain mineral density, and reduce the risk of fractures when subjected to impact. Moreover, regular exercise also helps improve overall blood circulation, thereby enabling important nutrients such as calcium and phosphorus to be transported more effectively to bone tissues. This not only maintains bone density, but also enhances the flexibility and resilience of bones, providing optimal support in preventing osteoporosis and its severe complications. Exercise also helps elderly people maintain agility, quick reflexes, and improve balance, key factors in preventing falls, a common cause of bone fractures in older adults. There are various forms of exercise that help maintain bone density, suitable for each individual's physical condition, preferences, and living circumstances. Among them, weight-bearing exercises are the top recommended choice. This group of exercises requires the body to work against gravity during movement, such as walking, climbing stairs, and dancing. These activities do not require complex techniques, are easy to perform anywhere, and are suitable for many people. For example, maintaining the habit of walking about 30 minutes a day, at least 5 times a week, has shown clear effectiveness in maintaining bone density. In addition, simple movements such as standing up and sitting down, stepping up and down on a chair, are weight-bearing exercises that impact the hip and spine areas, the locations most commonly affected by osteoporosis. Dancing and gentle aerobic exercise with flexible, rhythmic movements not only help improve cardiovascular health, but also apply force to the bones in various directions, stimulating a more comprehensive bone formation process. It is impossible not to mention strength training exercises, a powerful support factor for bone and joint health. Training with light dumbbells or resistance bands helps increase muscle strength while creating positive pressure on the bones. When muscles are strong, the pulling force on the bones is greater, causing the bones to increase their density to adapt. Older adults can start with light weights, performing 8 to 12 repetitions per movement, then gradually increase the intensity. Movements such as seated weightlifting, leg presses, and resistance band pulls are all suitable and easily adjustable according to each person's health. In addition to helping maintain bone density, strength training also supports flexible movement, balance, reduces the risk of falls, and improves posture, which is especially important for those at risk of developing a hunched back due to osteoporosis. Next are the exercises that enhance balance and coordination. Falling due to loss of balance is one of the greatest risks causing bone fractures, especially in the hip area of the elderly. Activities such as yoga, tai chi, or simple exercises like standing on one leg and shifting body weight not only help improve balance ability, but also enhance reflexes, helping practitioners feel more confident in daily activities. These exercises do not require much equipment or large space and can be done at home or outdoors, providing both physical and mental benefits, reducing stress, and improving sleep quality. For those with joint pain or underlying conditions, activities that support flexibility and reduce impact, such as swimming and cycling, are also ideal choices. Although they do not put as much stress on the bones as weight-bearing exercises, These forms help increase endurance, improve cardiovascular function, allow joints to move gently, reduce pain, and maintain physical fitness. Combining various types of physical activities will help the body develop comprehensively, optimizing benefits for the skeletal system as well as overall health. However, elderly people need to pay special attention when starting or changing exercise habits. Consulting a doctor or physical therapy specialist is essential to assess health status, choose appropriate forms and intensity of exercise, and minimize the risk of injury. Proper warm-up before exercising and stretching afterward are steps that cannot be skipped to protect muscles and joints. It is advisable to start with gentle exercises, gradually increasing duration and intensity according to one's ability, avoiding overexertion that causes pain, fatigue, or even unfortunate falls. Alongside exercise, a proper nutrition regimen plays an inseparable role in protecting and regenerating bones. A diet rich in calcium from milk, small fish, dark leafy greens, along with vitamin D from morning sunlight, eggs, and fish liver provides essential materials for bone development. If necessary, micronutrients can be supplemented through supplements as directed by a doctor. Limiting alcohol, quitting smoking, controlling weight, and getting enough sleep are factors that create optimal conditions for healthy development of bones and the entire musculoskeletal system. Exercise only truly takes effect when combined synchronously with a reasonable diet, rest, and lifestyle. Although age increases, with perseverance and proactive care for bone and joint health, everyone can completely maintain an active, independent, and joyful life every day. Like an unceasing journey, taking care of strong bones today is the foundation for a fulfilling quality of life tomorrow.